My shift is over. I don't know who's coming on in my place, but I have to go now. I've heard that, I've seen that. Not here at St. Francis, but what I'm saying is comparing that to the two caregivers, the two nurses in the room, one saying to the other, this is a description of the patients that we're going to talk about right now that's in this bed. Very personal, upfront, and actually transitioning that responsibility from a name to another name that makes the patient, I think, and the family, if they happen to be involved, very comfortable with the situation.
But generally, the information that they exchange from a patient point of view is, at least the nurse coming on knows a little bit of what's transpired in that prior period of time. And as a dialysis patient, it made a great difference to me that that nurse coming on was aware of when it needed to be done the next time and that that was in their schedule.
So I saw everything that transpired, and it made me feel good when a nurse came in and, number one, identified herself and then went over with my husband about what his meds were, what he wasn't taking, what he was taking, and you saw the two nurses there sharing information. It was a friendly time, it was a personable time, and it meant to me, it meant that the nurse that was leaving cared a lot about us to take that time and come in and talk to us about everything she had done for my husband and what he still needed to be done for him on this next shift. So it made us feel very good that this nurse cared that much to stay behind and do that so that my husband was comfortable with his new nurse.
Hello, my name is Barb Gesme, and I'm the chief nurse here at St. Francis Medical Center, and we are so excited to bring you this new video on the Bedside Care Report. I hope by now you're all familiar with our must-haves here at St. Francis Medical Center. The first one is leader rounding. This is where every leader rounds on every patient every day. Next, we have purposeful hourly rounding. To ensure the safety of our patients, we strive to proactively round on our patients about every hour, asking specific questions. Next, it's the bedside care report. The off-going nurse will come with the oncoming nurse and give report of the patient's care at the bedside, including our patients and families if they're there in this conversation. The foundation of each of these is AIDIT, and this is our communication tool we use to explain to patients, families, and our staff members our roles, our names, and what we are doing and why we're doing it. This video will focus on our bedside care report. This is not a new expectation for us, but we have made some changes to enhance this experience for our patients and family members. We noticed, based on our safety events being reported throughout our facility and from feedback from our patients, that we had an opportunity to improve this process. We put together a team of frontline nurses from each of our units and conducted a survey monkey that was sent out to nurses because we felt it was so important to get your input to help guide this work that was being done around Bedside Care Report. If you should have any questions about what you see in this video, please don't hesitate to give me a call.
My name is Polly Rabel. I'm Director of Service Excellence at St. Francis Medical Center. I want to walk you through what some of the changes are to the Bedside Care Report. First of all, the name. In the past, we've called this Bedside Shift Report, but when we worked with our patients, they told us that that name didn't mean much to them. They prefer to call it the Bedside Care Report. We've broken the Bedside Care Report into 3 sections. The first is the introduction. Of course, that includes AIDIT and one additional piece of information, a personal connection. This can be anything that you've learned about the patient in the past 12 hours that you've spent with them. It could be that they like the cooking channel, or that you know that a certain family member is coming to visit. What we know is that that personal connection is incredibly important to the patient. If the patient came in overnight and you haven't had a chance to connect, now's the perfect time to do it. As you're introducing the oncoming nurse, try to learn something new about the patient. Where are they from? What family members do they have in town? This is a great way to set the oncoming nurse up for an excellent 12-hour shift with the patient.
Hi there, I'm back. Can we come in?
Yes.
Wonderful. This is Nicole.
Hi, Nicole.
She's going to be your nurse today.
Okay.
She'll
Good
be
morning. How are you?
I'm okay.
She'll be here with you till about 7:30 this afternoon.
Okay.
She's one of my favorites. Don't tell anybody.
Okay.
Okay.
Well,
Is it
then
okay?
she'll be my favorite too next to you.
She's been my favorite patient. She's got a trip planned to Japan, so she's anxious to get out of here.
Okay.
Awesome. So I'm just going to tell her a little bit about your care,
Okay.
kind of your course since you've been here, why you came in,
Okay.
and then your plan for today.
Okay.
If you have any questions or you feel like we missed something or you want to interject, just feel free to speak up, okay?
Okay.
My name is Jennifer Stanley. I'm the nursing director here at St. Francis Medical Center for the Medical Surgical Unit. Section 2 is the SBAR, and it's all about validation and verification. So the key thing in this section is validating the information via the computer. As you know, change of shift is where the majority of safety events get put into motion. It's a hectic time and mistakes can be made. Validating the information you are giving and receiving using the patient's chart is essential. If this is not done, how do you know what you are being told is the correct information? So another key piece to Section 2 is the standardization. So we have standardized some key clinical information that we want to make sure that is transferred from one nurse to another no matter what the unit. Based on feedback from your peers, there is much variability on how report is given. Some variability is expected based on the unit, but there should be a core set of information that's transferred for the safety of the patient.
All right. Pull up your chart here. Okay. So this is Barb Gesme. She prefers to be called Barb. She's 53 years old. She came into us on the 26th into our ED, complaining of shortness of breath. There they did a chest x-ray which showed left lower lobe pneumonia. She is a full code and has no known drug allergies. You don't have any allergies, do you?
No, I just remember, I just thought of this. I got nauseated when I took codeine. Is that an allergy?
It's more of a side effect, but we'll be sure that your physician knows.
Okay.
Okay.
And I made a note of it, so we'll certainly follow up.
Okay.
Perfect. She does have a history of hypertension, asthma, and chronic kidney disease. She's been alert and oriented ×3. She is on 2 liters of oxygen. We have a respiratory consult. Her lungs have been clear, but she has this non-productive cough. Anything coming up for you this morning?
No, it just still hurts when I cough in this side, ribs, I guess.
Okay. Yeah, she has been complaining of this rib pain when she's coughing, rates it as a 4 out of 10.
Okay.
I gave her some Percocet, 1 tablet, around 6:10 this morning, and she can have that every 4 hours.
So you're due at 10:10 today. Just let us know, okay? And we can certainly get you something.
She has been on IV antibiotics, but we've discontinued those. She's on oral now.
Okay.
She has a Schmidt score of 3. She's normally up ad lib, but because she's getting the pain medication, it makes her a little dizzy. And she's got the oxygen, and I've warned her about the tubing, so if she needs to get up out of bed.
I have to call the nurse. I can't get up by myself.
That's right. She's been a very good patient. She's been listening to us. Her skin is clean, dry, and intact. And there have been no other safety concerns with her. Anything I missed? Anything I left out?
I don't think so. Just in going home, I'll go home on antibiotics too?
Yes, you will be going home on oral antibiotics, and Nicole will be sure that you get all of that information with your discharge packet.
Yeah, so when we come in to do your discharge instructions, we'll go over all that information. We'll talk about all the medications that you'll be taking as well as your follow-up appointment time.
Okay.
We do have a discharge time at 11 o'clock.
Oh,
So
okay.
have you been able to call your husband and let him know, or your family member who's coming to get you?
Yeah, it is my husband,
Okay.
but I don't know if he'll be able to get here right at 11. Is that a problem?
It's not a problem. We have a lovely comfort lounge where we can have you spend some time until your husband comes.
Oh, okay.
Okay?
Okay.
So we're just going to go over a couple of things, make sure everything's in order, and certainly if you have any questions while we're doing that, please feel free just to ask.
Okay.
Okay? So I see that your oxygen is at 2 liters. Just want to verify that. I'm just going to check your bed alarm, and your bed alarm is set. So remember, the bed alarm is there just to alert us if you need some assistance and forget to give us a call. Is that okay?
Mm-hmm.
Okay, so I'm just going to check your IV site. And that looks good. And can you tell me your name and date of birth?
Barbara L. Gesme, 9/15/65.
Okay, all right. So I'm just going to go put my name on the whiteboard. Remember, my name is Nicole. And I'm just going to put the time that I've been here. It's 7 o'clock in the morning. So I know Yolanda reviewed with you that we do purposeful hourly rounding. So a member of the care team is going to come back and update the board every hour just to go over that to make sure that you have everything by your bedside, that your needs are always met, and if you need some assistance going to the bathroom.
Okay.
Hi, I'm Lauren Lewis. I'm one of the Performance Improvement Coordinators here at St. Francis Medical Center. I want to talk to you today about Section 3, the closing. What is the patient's plan today? What is the patient's goal? Is the patient ready for discharge, or are there any treatments or tests that they should anticipate today? Be sure to invite the patient and any family members who are in the room into the conversation. Allow them the opportunity to ask questions. This is very important. Review expectations of purposeful hourly rounding. Let them know that about every hour, somebody from the care team will be in to check on them. Ask if there's anything else that you can do for them before you leave. This is really important. And don't forget the T in AID IT. Thank you. Before you leave the room, make sure you thank them.
Right now, thanks.
Okay. All right, so we'll be back in about an hour or so. Can I do anything for you right now? I have the time.
No, thank you.
Okay. All right.
Well, thanks, Barb. It was such a pleasure taking care of you.
Thank you.
Had a great time learning about your
to have you here too.
Have fun in your upcoming trip.
Thank you.
Right.
Okay.
It's been a pleasure.
Hi, Barb Gesme, Chief Nurse at St. Francis again. We want to thank you for watching this video, and thank you for taking the safety of our patients so seriously, and thank you for being part of the St. Francis family.